Welcome to Sciencera. In this video, we're going to discuss part 2 of the skeletal system, in which we are going to look at axial skeleton, vertebral column, and appendicular skeleton. Starting with the skull, we're going to look at the diagram of the skull, name bones of the skull, and four major skull sutures. And then we're going to describe how the skull of a newborn infant differs from that of an adult. Bones of the skull. The skull is formed by two sets of bones. The cranium encloses and protects the fragile brain tissues. The facial bone form a cradle for the eye that is open to the interior and allow facial muscle to show expressions. Bones of the skull are joined together by sutures which are interlocking immovable joint. Only the mandible jawbone is attached to the rest of the skull by a freely movable joint. Cranium, first set of bones in the skull, includes six bones: frontal bone, parietal bone, temporal bone, occipital bone, sphenoid bone, and ethmoid bone. Let's look at each bone in detail. Starting with the frontal bone. Frontal, the forehead, the bony projection under the brows, and superior section of each eye's orbital are all formed from the frontal bone. Parietal bone. Most of the superior and lateral walls of the cranium are formed by the paired parietal bones. Sagittal sutures are formed when two parietal bones meet in the middle, while the coronal sutures are generated where the paired parietal bones meet the frontal bone. Then we have temporal bones. Temporal bones lies inferior to the parietal bones and they join them at the squamous sutures. Let's look at the bone markings on the temporal bone. First one is the external acoustic meatus. It is a canal that connects the middle ear to the eardrum. It's the pathway through which sound enters the ear. Second one is styloid process. It is right below the external auditory meatus, a pointed needle-like projection. Styloid process serve as an attachment site for many neck muscles. Zygomatic process is the narrow bone bridge that connects the cheekbone zygomatic bone to the zygomatic process anteriorly. Then we have mastoid process. It is a rough projection posterior and inferior to external acoustic meatus that is full of air cavities, mastoid sinuses. It serves as a point of attachment for various neck muscles. Last one is the jugular foramen. It is located at the intersection of occipital and temporal bone, permits the jugular vein, the head's largest vein, to drain blood from the brain. Internal acoustic meatus, which carries cranial nerve 7 and 8, is just prior to it in the cranial cavity. The facial and vestibulocochlear nerve. The carotid canal travels anterior to the jugular foramen on the inferior part of the skull, delivering the blood to most of the brain. So, five types of bone marking on the temporal bones are external acoustic meatus, styloid process, zygomatic process, mastoid process, and the jugular foramen. Next is the facial bones. The first one is maxilla. Maxillary bone fused to form the upper jaw. The maxilla carries the upper teeth in alveolar process. Extension of maxilla called the palatine process forms the anterior part of the hard plate of mouth. The maxilla contains sinuses which drain into the nasal passage. These paranasal sinuses lighten the skull bone and amplify the sound we make as we speak. Next is zygomatic bone. Zygomatic bones are commonly referred to as cheekbones. They also form a good sized portion of the lateral walls of the orbits. Lacrimal bone. Lacrimal bone are fingernail-sized bone forming parts of the medial wall of each orbit. Each lacrimal bone has a groove that serves as a passageway for tears. Nasal bone. Small rectangular bones forming the bridge of a nose are the nasal bone. The lower parts of the skeleton of nose is made up of haline cartilages. Then we have vomer. Single bone in the medial line of the nasal cavity is the vomer. The vomer forms the inferior part of the bony nasal septum which separates the two nostrils. Inferior nasal concha. Inferior nasal conchae are thin curved bone projection medially from lateral walls of the nasal cavity. Next is mandible. Mandible is the largest and strongest bone of the face. It joins the temporal bone on each side of the face, forming the only freely movable joint in the skull. The horizontal part of the mandible forms the chin. Two upright bars of the bone extend from body to connect the mandible with temporal bone. The lower teeth lies in the alveoli in the alveolar processes at the superior edge of the mandibular bone. Next is the bones of cranium. Occipital bone. The occipital bone is the cranium's most posterior bone. The base and the back wall of the skull are made up of it. The lambdoid suture connects the occipital and parietal bones anteriorly. Foramen magnum is wide aperture at the base of the occipital bone. The foramen magnum connects the spinal cord to the brain and surrounds the bottom half of the brain. The rocker-like occipital condyle, which rests on the first vertebra of the spinal column, are lateral to the foramen magnum on each side. Sphenoid bone. Cranial cavity's floor is made up of the butterfly-shaped sphenoid bone, which covers the width of the skull. Cilia tursea, a little dip in the middle of the sphenoid that makes a tight cage for pituitary gland, is in the middle of the sphenoid. Foramen ovale, a wide oval orifice parallel to the cilia posterior's end, allows cranial trigeminal nerve fibers to flow to the lower jaw's chewing muscles. The optical canal, which permits the optical nerve to flow to the eye, and slit-like superior orbital fissure through which the cranial nerve regulating eye movement travels, are both located on the sphenoid bone, which is visible from the outside as part of the eye orbital. Next we have ethmoid bone. Anterior to sphenoid is an irregularly formed bone. It is the roof of the nasal cavity and a section of the orbital medial wall. The cristae galli protrudes from its superior surface. This projection is attached to the brain's outermost layer. There are numerous tiny holes on both sides of the cristae galli. The cibriform plates are hollow structures that allow nerve fibers delivering impulses from the nose olfactory receptor to reach the brain. The superior nasal conchae and the middle nasal conchae are extensions of the ethmoid bone that make up the lateral walls of the nasal cavity. The last bone found in the cranium is the hyoid bone. The hyoid bone is connected to the mandible and temporal bone, even though it is not component of the skull. Hyoid bone is the only bone in the body that does not articulate with other bones. Instead, it hangs from the ligament attached to the styloid processes of the temporal bone in the mid neck area about 2 cm above larynx. The hyoid bone, which is horseshoe shaped and has two pairs of horns serve as a movable basis for the tongue and an attachment point for the neck muscles that raises and lowers the larynx when we swallow and talk. Next, we're going to look at the vertebral column. In this section, we're going to name the parts of a typical vertebra, explain in general how cervical, thoracic, and lumbar vertebra differ from one another. Then we're going to look at the importance of intervertebral disc and spinal curvatures. Explain how the abnormal spinal curvatures differ from one another. Vertebral column. The vertebral column, often known as spine, runs from the base of the skull to the pelvis, where it transmits body's weight to the lower limb. Spine is made up of 26 uneven bones that are joined and supported by the ligaments to produce a flexible curving framework. Spine is made up of 33 individual bones called vertebra before birth, and 9 of them eventually merge to form the sacrum and coccyx, which makes up the inferior half of the vertebral column. The cervical vertebra are the first 7 bones in the spine, followed by the thoracic vertebra, and finally the lumbar vertebra, which supports the lower back. You can see on the screen the highlighted in blue is the cervical curvature, in green is thoracic curvature, in purple is lumbar curvature, and in orange is sacral curvature. Intervertebral discs are flexible fibrocartilage pads that cushions and absorb shock while allowing the spine to move freely. Spine curvatures in thoracic and sacral region are referred to as a primary curvature because they are present when we are born. The curvature in the cervical and lumbar regions are referred to as secondary curvature because they develop some time after the birth. Next is a structure of a typical vertebra. The disc-like weight-bearing section of vertebra facing anteriorly in the vertebral column is called the body or centrum. Posterior extension of the vertebral body, laminae and pedicles unite to form the vertebral arc. Spine, spinal cord goes via the vertebral foramen, which is a canal. The vertebral arc's transverse processes are two lateral projections. A single projection emerging from the posterior aspect of the vertebral arc is known as spinous process, the fused lamina. The superior and inferior processes at inferior articular processes are paired projection lateral to the vertebral foramen that allow a vertebra to make joints with neighboring vertebra. Structural characteristics of the spine. Cervical vertebra. Neck region of a spine is made up of 7 cervical vertebra numbered C1 to C7. Because they execute activities not shared by other cervical vertebra, the first two vertebra are distinct. They are called atlas and axis. The atlas C1 is devoid of a body. Large depressions on the superior surface of its transverse processes receive the occipital condyle of the skull. The axis C2 function as pivot for the atlas and skull above to rotate. The dents, which is a huge upright process, serve as a pivot point. Typical cervical vertebrae. From C3 to C7 are the typical cervical vertebra. They are tiniest and lightest vertebra in spinous processes that are usually short and separated into two branches. The vertebral arteries follow through foramina openings in the transverse processes of cervical vertebra on their route to the brain above. When you observe these openings in a vertebra, you should know it's cervical vertebra right away. Next, we have thoracic vertebra. From T1 to T12 are the typical thoracic vertebra. They are bigger than the cervical vertebra and the only ones that articulate with the ribs. The body is formed like a heart and features two costal facets, articulating surfaces on each side that receive ribs head. Each thoracic vertebra's transverse processes connect to the ribs knob-like tubercles. When viewed from the side, the spinous processes is long and hook sharply downward, reassembling resembling the head of a giraffe. Lumbar vertebra. The bodies of the five lumbar vertebrae from L1 to L5 are large, blocky, and kidney bean shaped. From the side, their short hatched shaped spinous processes resemble the head of a mouse. Lumbar vertebrae are the strongest of the vertebrae because they bear the brunt of load on the vertebral column. Next is the sacrum. It is made up of five vertebrae that have fused together. It joins with L5 on the superior side and the quercus on the inferior side. The sacroiliac joint is formed when each wing, like ALA, articulates laterally with the hip bone. Posterior wall of the pelvis is formed by the sacrum. Medial sacral crest, which consists of fused spinous processes of the sacral vertebra, roughens the posterior midline surface. Posterior sacral foramina flanks it on the side. Sacral canal follows the spinal canal into the sacrum and ends in a wide inferior aperture called the sacral hiatus. The coccyx. It is made up of 3 to 5 small, oddly shaped vertebrae that fuse together. It is the human tailbone, which is a relic of a tail found in other vertebra animals. Next is thoracic cage. In this section, we're going to name components of the thoracic cage and we're going to describe how a true rib differs from the false rib. Sternum, rib, and thoracic vertebra make up the bony thorax. The bony thorax is routinely called the thoracic cage because it forms a protective cage of slender bones and cartilages around the organs of the thoracic cavities. The organs include heart, lung, and major blood vessels. The sternum. Manubrium body xiphoid processes fuse together to form sternum, which is a typical flat bone. Costal cartilages connect it to the first seven pairs of the ribs directly. Jugular notch can be palpated easily. Generally, it is the level of the third thoracic vertebra. Then we have the sternal angle. The sternal angle is generated when the manubrium and the body meets at the level of the second ribs, forming a transverse ridge. It serves as a convenient reference point for counting ribs and locating the second intercostal space, which can be used to listen to the heart valves. The last is a xiphi-sternal joint. The point where the sternal body and xiphoid process fuse lies at the level of the ninth thoracic vertebra. So the green part is the manubrium, the blue part is the body of the sternum, and the purple one is xiphoid process. The ribs. 12 pairs of ribs form the wall of the bony thorax. All the ribs articulate with the vertebral column posteriorly and then curve down and towards the anterior body of the surface. The true ribs, the first seven pairs, attach directly to the sternum by costal cartilage. False rib, the next five pairs, either attach indirectly to the sternum or are not attached to the sternum at all. The last two pair of the false ribs lack the sternal attachment, so they are called the floating ribs. Intercostal spaces between the ribs are filled with intercostal muscles which aid in breathing. Moving on to the appendicular skeleton. Here we're going to identify on a skeleton or diagram the bones of the shoulder, pelvic girdle and their attached limbs. We're going to describe difference between a male and female pelvis. Bones of the shoulder or also known as pectoral girdle contain two bones, a clavicle and a scapula. The clavicle are a pair of slender double-curved bone. Each clavicle connects to a sternum manubrium medially and the scapula laterally, forming the shoulder joint. The clavicle work as a brace, preventing shoulder dislocation by keeping arm away from the top of the thorax. Our arms are moved posteriorly by the paired scapula or shoulder blades. The scapula are not connected to the axial skeleton directly. Let's look at the scapula in detail. Scapula is loosely held in place by trunk muscles flattened by the body with three borders, superior, medial and the lateral borders. It also has three angles, superior, inferior and lateral angle. In the lateral angle, the glenoid cavity is a shallow socket that accepts the head of the arm bone. The acromion and the clavicle meet laterally at the acromioclavicular joint. Carcoid process connects some arm muscles and extend laterally over the top of the shoulder. The suprascapular notch is medial to the carcoid process. So here you can see the carcoid processes, and this is a suprascapular notch which is medial to the carcoid processes. Medial mean in the center. The shoulder girdle is externally extremely light, allowing the upper limb to move freely. The reason behind this are as follow. The glenoid cavity is shallow and the shoulder joint is inadequately strengthened by the ligament. Each shoulder girdle joins to the axial skeleton at only one point, the sternoclavicular joint. The loose connection of the scapula allows it to glide back and forth against the thorax as a muscle function. Next is the bones of upper limbs, starting with the arms. Arms is formed by humerus, which is a typical long bone as you can see on the screen. At proximal end, rounded head fits into the shallow glenoid cavity of the scapula. Inferior to the head is a slight constriction called anatomical neck. Anterolateral to the head are two bony projections separated by intertubercular sulcus, the greater tubercle and the lesser tubercle sites of a muscle attachment. Distal to the tubercles is the surgical neck. In the midpoint of the shaft is a roughened area called deltoid tuberosity where fleshy deltoid muscles of the shoulder attaches. The radial groove runs obliquely down the posterior aspect of the shaft which marks course of the radial nerve. At the distal end of the humerus is the medial trochlea and the lateral ball-like capitulum. Both processes articulates with bone of the forearm. Above the trochlea anteriorly is a depression, the coronoid fossa on the posterior surface in the olecranon fossa. These two depressions, which are flanked by the medial epicondyle and lateral epicondyle, allow the corresponding processes of the ulna to move freely when elbow is bent and extended. Bones of the upper limbs, the forearm. Radius and the ulna form the skeleton of the forearm. In the anatomical position, radius is lateral bone on the thumb side and the ulna is the medial bone on the little finger side of the forearm. Both proximally and distally, the radius and ulna articulate at the small radio-ulnar joint connected by the flexible interosseous membrane. Both the ulna and radius have a styloid process at their distal end. The disc-shaped head of the radius also forms a joint with capitulum of the humerus. Tendon of bicep muscles attach at the radial tuberosity. On the proximal end of ulna is the anterior coronoid processes and is posterior olecranon separated by the trochlear notch. Together these two processes grip the trochlea of the humerus in a curved tongue-in groove-like joints. Bones of the limb, upper limbs, the hand. The skeleton of the hand consists of carpals, the metacarpals and phalanges. The eight carpal bone arranged into irregular row of the four bones form part of the hand called carpus. They are bound together by ligament that restrict movement. The palm of the hand consists of metacarpals. They are numbered 1 to 5 from the thumb side of the hand towards the little finger. The phalanges are the bones of the finger. Each hand contains 14 phalanges. There are three in each finger: proximal, middle, and distal, except in the thumb, which has only two: proximal and distal phalanges. Bones of the pelvic girdle. The pelvic girdle is formed by two coxal bone, commonly called hip bone, and the sacrum. Together with the coccyx, the pelvic girdle form the pelvis. Three bones and the ilium, ischium, and pubis comes together to form each hip bone, or also known as coxal bone. Most of the hip bone is formed by the ilium, which links posteriorly to the sacrum at the sacroiliac joint. Your hand rests on the ala or wing-like section of a ilia when you put them on your hips. In the anterior superior iliac spine and posterior superior iliac spine, the iliac crest terminates. Below these are the few little inferior spines. Then we have pubic symphysis. The pubic symphysis is a cartilaginous joint formed by the pubic bone of each hip bone articulating anteriorly. The bigger sciatic notch permit blood vessels and the major sciatic nerve to travel posteriorly into the thigh from the pelvis. Ischium is located at the bottom of the coxal bone. When you sit, the ischial tuberosity is roughened area that bear your weight. Then we have ischial spine. Superior to the tuberosity, the ischial spine narrows the pelvic outlet through which the infant must pass during the birth. Pubis. The pubis is coxal bone's most anterior and inferior component. Then we have obturator foramen. The obturator foramen, an aperture that permits blood vessels and nerves to enter the anterior region of a thigh, is encased by a bar of bones formed by fusion of the rami of the pubis anteriorly and the ischium posteriorly. Bones of the pelvic girdle. The bony pelvis is divided into two regions. The false pelvis is the superior to the true pelvis. It is the area medial to the flaring portions of the ilia. The true pelvis is surrounded by the bones and lie inferior to the flaring parts of the ilia and the pelvic brim. Difference between a male and female pelvis include the following characteristics. First one is female inlet is larger and more circular. The female pelvis is shallower and the bones are lighter and thinner. Female ilia flare more laterally, giving a woman curvy hips. Female sacrum is shorter and less curved. The female ischial spine are shorter and farther apart, thus the outlet is larger. The female pubic arc is more rounded because the angle of the pubic arc is greater. So on the top diagram you can see the male pubis, and in the bottom diagram you can see the female pubis. Bones of the lower limb, the femur. Femur is the heaviest, strongest, and the longest bone in the thigh. Its proximal end has a ball-like head, a neck, and a greater trochanter and the lesser trochanter, separated anteriorly by intertrochanteric line and posteriorly by the intertrochanteric crest. The head of the femur articulates with the deep socket of the acetabulum of the hip bone. The femur slants medially as it runs downward to join with leg bones. The medial course of a femur is more noticeable in women because of the wider pelvis. Distally on the femur are the lateral condyle and medial condyle, which articulate with tibia below. Posteriorly, these condyles are separated by the deep intercondylar fossa. Anteriorly on the distal femur is smooth patellar surface which forms a joint with patella. The leg. Connected along the length by interosseous membrane, two bones, tibia and fibula, form the skeleton of the leg. The tibia and shin bone is larger and more medial. At the proximal end, the medial condyle and lateral condyle, separated by intercondylar eminence, articulate with distal end of the femur to form a knee joint. The patellar ligament encloses patella, a sesamoid bone attaches to the tibial tuberosity, a roughened area on anterior tibial surface. Distally, a process called the medial malleolus forms the inner bulge of ankle. The anterior surface of the tibia is a sharp ridge anterior border that is unprotected by muscles. Thus, it is easily left beneath the skin. The fibula, which lies alongside the tibia laterally, forms joints with it both proximally and distally and is a thin and stick-like. The fibular distal end, the lateral malleolus, forms the outer part of the ankle. Bones of the lower limb, the legs. The foot, composed of tarsals, metatarsals, and phalanges, has two important functions. It supports our body weight and serves as a lever that allow us to propel our bodies forward. The tarsus, forming the posterior half of the foot, is composed of seven tarsal bones. Body weight is carried mostly by the two largest tarsals, the calcaneus or the heel bone, and the talus. The talus lies superior to calcaneus, articulates with the tibia and allow pointing of the toes. 5 metatarsals form the sole and 14 phalanges form toes. Each toe has 3 phalanges except the greater toe, which has 2. The bone in the foot are arranged to form 3 strong arcs, 2 longitudinal, medial and lateral arc, and the 1 transverse. Ligament which bind the foot bone together helps help to hold the bone firmly in the arched position. Weak arcs are referred to as phalan arcs or a flat feet. This brings us to the end of axial skeleton and appendicular skeleton. Thank you for watching. In the next video, we're going to discuss joints and the developmental aspect of the skeleton. If you like my video, don't forget to subscribe for more. Thank you.